So today's presenters, Julie and myself from the National Center on Elder Abuse, will be providing you with more information about elder abuse and its connections to the current COVID pandemic. So the National Center is one of 27 federally funded resource centers, and our area of expertise lies in providing information about elder abuse, neglect, and exploitation. So we've been around within the University of Southern California for almost 6 years, and we are here to provide more information to the public and professionals and really assist advocates and older people with advocating for themselves and their community. And we have a wide variety of information and materials which we'll be sharing with you towards the close of this presentation today. So our goal at the National Center on Elder Abuse is to really improve the national response as it relates to elder abuse, neglect, and exploitation. And the way that we do that is by gathering, housing, and disseminating current information. We also help in identifying new approaches to responding to elder abuse and also detecting and addressing gaps in the field. And we regard ourselves as a resource center that is an entity that others could look to when in need of information. And we really envision ourselves as a part of that global movement to work towards ending abuse and spreading awareness. So in regards to what we offer at the National Center on Elder Abuse, we, as I mentioned, see ourselves as the go-to authority on all matters relating to elder abuse, neglect, and exploitation. And how we do that is through a number of channels. So we make our information accessible on different social media platforms like LinkedIn, Twitter, and Facebook. And we share information regarding the latest field research. We have a very thorough website and series of websites where we are constantly updating the research that is known in the field of elder abuse, and we're also distilling that research and incorporating that in different publications that we have available on our website. We also provide training, which is what we're doing here with you today. And we also operate a forum for professionals and graduate students to exchange information, and this is called our Elder Abuse Listserv. We, related to research and response efforts, are always very willing to engage professionals and community members and provide them with our own guidance and suggestions. And we're really trying to heighten the awareness on our cause by emphasizing that elder abuse is a social issue that matters. And the way that we're doing that is by working with a communications firm called the Frameworks Institute and disseminating a research-informed communication strategy called Reframing Elder Abuse. And also, I think all of us know someone who knows someone, and we're really here to guide you and provide information and referral services. So let's talk a little bit about why all of us should consider being involved. What you have to know, first and foremost, is that elder abuse is vastly underdetected and underreported. Our best estimates in our field are that about 1 in 10 people over the age of 65 are being abused, neglected, or exploited each year. And we're 3 months into a new decade, so Julie, I'm sure that you'd agree that our field is ready to get our hands on some new data and updated prevalence statistics. We can only expect that there are many more cases that we don't know about. And in terms of some general knowledge about what we do know, about 1 in 24 cases of elder abuse in the U.S. go reported. And back in the last decade, 2010, there were 5.9 million reported cases of elder abuse, and we can only expect that that is going to continue to grow. So who's at risk for elder abuse? I just want all of you to know that elder abuse doesn't really discriminate. It impacts people regardless of their ethnicity or gender. And most oftentimes, it impacts people in their latter 70s, and 2/3 of the victims are actually female. Also, people with dementia or Alzheimer's disease are twice as likely to experience abuse.
Thank you so much, Eden. And what we also do know is that the #1 risk factor for elder abuse is social isolation. And it's ironic right now, and I'm going to address this in just a minute. Social isolation is not the same as social distancing. When a person is socially isolated, they can be more susceptible to different types of fraud and abuse. And I need you all for a moment to just step into the shoes of an older adult that you might know. And we often question, how can somebody fall for these lottery scams? Or, why did they give their money to this person? Well, I want you to think of this. If you are a person who gets all of your news through the newspaper, that's your way of, I still enjoy reading the newspaper on the weekends. If you are suffering some type of visual loss, visual acuity, macular degeneration, your vision can be like this slide here. And it becomes a very frustrating experience, something that gave you pleasure. So now you may not want to read the paper as much. Or if this is what the TV screen looks like to you, then it's, again, not an enjoyable experience. So you become isolated. Your world becomes smaller. The same with auditory cues. If it's more difficult for you to hear, if large groups make it so difficult for you to pick out what someone is saying, they're trying to make plans and you're in a social setting, and you're just, at some point, you just give up asking, could you repeat that? Could you repeat that? Because you don't want to do that anymore. So you just stop asking and nod your head and smile, and you're disconnected. Again, you're cut off from a source of information from friends, family, and neighbors. So you can see where this can happen. And then we add a layer on of the loss of wheelchair, or loss of mobility, having to use a wheelchair or a walker. It's not so easy to get out anymore. If you lose your driver's license, now you're depending on somebody else to take you places. And now your world has just turned to the four corners of your room sometimes. And so that's how it happens. That phone rings and you pick it up and somebody promises you something or threatens you by saying you haven't paid your income taxes, and you respond. And that's how this happens. So now we're in a bit of a conundrum because now we have the COVID situation happening, and we're all being told to socially distance, to self-isolate, much different than social isolation, but to self-isolate. And so how can we deal with this? And as professionals, we're so happy to have this opportunity to talk to you all because I think we can brainstorm a little bit together. And so what we have to look for are some safe communication pathways. If we're going to be calling people on the phone through phone reassurance programs, we need to communicate. These are safe phone numbers that are going to be coming through. We need to have that acknowledgement that, or they should initiate the phone call. Is there a neighbor, a family member, grandchild that you can call and have a check-in system developed, like how are you doing today? And then there are many friendly visitor programs that are available, and we're trying to get those resources more put together to make sure they're as credible as possible. A lot of faith-based organizations have these, and so we're really trying to make sure that people can stay connected. We at the center want our information to be clear and concise. And I'm always saying I get overwhelmed by the amount of information I'm getting on numerous emails. So let's keep it simple, let's keep it concise, let's keep it clear, and check in and be as connected as we can. So that's why we're going through our resources and trying to make them more accessible for people. Okay, now we can take you through some of the basics here.
As the major categories of elder abuse. Although there are distinct types of abuse defined, it's not uncommon for an older person to experience more than one type of mistreatment at the same or even different times. So physical abuse is the use of force to threaten or physically injure an older person. Psychological or emotional abuse may occur based on verbal attacks, potentially threatening someone, rejecting a person, isolating a person, or even acting in belittling acts that cause or could cause mental anguish, pain, or distress to an older person. Financial abuse is the theft, fraud, or misuse of neglect and the use of undue influence as a lever to gain control over an older person's money or their property. Sexual abuse is contact that is forced, tricked, threatened, or otherwise coerced upon an older person And this also includes anyone who is unable to grant consent. And finally, neglect is the failure or refusal to provide an older person safety, physical or emotional needs. Based on the statistics that we've shared, you can see that elder abuse is a priority social issue for all of us. Elder abuse is impacting communities on many levels, from public health to even civic participation to economic resources. And the costs of elder abuse are high for the affected individuals, but also our society. Think about it. It can overburden our social service systems. It creates extensive healthcare and legal costs. And it also reduces older people's perception and participation in their communities. Elder abuse isn't just a nursing home problem, and perpetrators aren't paid caregivers. Abuse occurs in older people's own homes, it occurs in their apartments, and actually, abuse most often is perpetrated by someone who's known and in a trusted relationship with an older person. So what makes someone more prone to experience any form of abuse? Elder abuse can really occur when we're all disconnected from our community. If we don't have accessible quality health care or public services like transportation, our population becomes more at risk for abuse as we age. Ageism is also something that's very important to point out, and what that is negative stereotypes based on prejudices about age, and that in turn can also drive discrimination and play a role in enabling elder abuse. So let's look at some of the aspects here in terms of talking about how elder abuse could happen. Thinking about isolation. Elder abuse can happen in a city or in a rural area. And an example of how that can occur is by potentially controlling transportation, potentially keeping an older person isolated away from their community, and also limiting access to visitors, friends, or family members. Also, elder abuse can happen through communication. So taking away the ability for an older person to communicate with their family on the phone or on the computer or through face-to-face interaction. Drug use as well. If drugs are present, it can increase perpetrator usage and also victim usage, and obviously that will increase the likelihood of elder abuse occurring. Thinking about anxiety, we are currently in a high anxiety situation with conflicting information that we're seeing currently with all of the headlines, and that could really make someone more prone to experiencing abuse. And think about how we're all potentially preoccupied with job loss and your finances drying up. Just imagine how older people in this setting are feeling as well, and that they're feeling increasingly isolated and that they don't have effective communication, whether that be with their friends or family members or other people that are helping with providing care.
And that's why you as advocates, we want you to be able to look for and know some of the signs and symptoms so that you're able to effectively work through them. And so I think in the physical signs of abuse, you're probably quite adept or would recognize definitely broken bones or bruises, bruising in unnatural areas. We do know that skin breaks down in older adults, and so bruising on the hands or where someone might normally try to assist someone isn't abnormal. But when it would be on the face or the neck or the middle of the back, some of those stranger areas, that's definitely a sign and symptom. And bed sores, signs of neglect or any type of stained or bloody clothing or underclothing. We don't ever want to rule out sexually transmitted diseases or sexual abuse that goes on. It goes on probably much more than we do know. And so looking for those signs is very important. Then also, when we have a lot of people in the banking industry who often report to us that people that they see a customer coming in normally and they're very well groomed, and then they notice this decline and they notice that they just don't seem to be well fed or they just aren't themselves. These physical signs are really telling, and they become very adept at letting us know. If the living conditions, of course, are deteriorating and poor hygiene, And then things that you might not think of that, if they always have their glasses with them or their hearing aids and those things are missing, then those might be some signs that there's some neglect happening that we want to look into. Something that might not be as apparent is the use of medication as a form of elder abuse. Over-medicating an older adult so they're more compliant, we call that chemical restraint. That is certainly a sign. Or, unfortunately, in the opioid epidemic that we have now, we find that older people's medications are being stolen and sold, and so a person not getting their medication, and so suffering the consequences of whatever that medication might be and not having it, that would certainly be a sign that we would want to be aware of and be able to utilize GLUE to make a report on elder abuse. Now, some of the others that are more difficult would be the emotional and behavioral signs. And that's somebody who's, normally outgoing and you can talk to them and now suddenly they seem to be more withdrawn or sleepy. That might be a sign of over-medication. The fear and anxiety, I think everybody's feeling that now, but just being aware of that. I think Eve made a good point when she said, we're all concerned about jobs and income. If you saw your life savings, suddenly gone in the stock market tumble, that causes everyone to be anxious. So being aware of that and being a little more responsive and maybe listen a little bit more, give them a little time. I think that's very important. And then that isolation from friends and family where suddenly they're cut off or they're not communicating, and then looking for the signs of sadness and depression that can happen. The financial signs I'll be going into a little bit more because you've all expressed that that is an area that you're seeing, so we are going to spend a little more time in that particular area. But we often work with guides that Eden was going to just tell you about, so you have some of these resources. Oh, there we go. Good.
Are some of our national partners, Adult Protective Services, a membership association that we work with is called NAPSA, and they have a wonderful website, a lot of research to practice translations, as well as information about who you can locally connect with to get your local APS information. And they also have some great literature on the different kinds of elder abuse that you could all read about regarding older people in community settings. NCAL, there are also Victims Advocates, Domestic Violence, Abuse in Later Life organization, and they have a wealth of training resources and materials on the topic as well. And finally, Dr. Mosqueda, who is our leader and director at the National Center, has conducted extensive research on bruising patterns and physical injuries, and she's always very willing to give and provide advice, as well as all of the professionals within our office who manage the day-to-day aspects of the NCEA Resource Center. And then also, in terms of financial abuse, with Julie, we'll get into a little bit after I provide some more information about these resources, and then we segue into the rest of the conversation. These are some of our recommended resource partners as well. So the Federal Trade Commission has a great complaint line where people can actually submit complaints, and the Internet Crime Complaint Center also has a website where you could submit complaints regarding internet scams and email scams. And finally, the Consumer Financial Protection Bureau provides great literature on how people can manage money, and they are an oversight organization that was created after the last recession that we had in 2008 and 2009, and just a wonderful source of information.
We love working with our partners at CFPB. They're really great. And, they even did a really nice job of already kind of defining financial abuse for you, but I put it up here for you so that you can see that the World Health Organization, has defined financial elder abuse as a public health issue, elder abuse in general, and then has broken out these definitions for us. So we, of course, want you to have these as a takeaway so that you can look at them and know how this is legally defined and have this information. But some of the things that we, of course, are seeing that you probably have noticed in some of your work with older people or maybe in your own life. I was talking to a friend this morning who's a graphic artist and said she's been bombarded by people saying, oh, I need a website. And she's, looking for work, and she got to the end of a conversation with someone after an hour, and then they wanted her bank routing number so they could deposit the money, and she knew that wasn't how it worked. And so we're all susceptible now. So these are signs that we should all be aware of, but when you're working with your older adults, definitely just those sudden changes in the bank accounts. Someone who's never used an ATM, which there are many people that just never have, and all of a sudden now some daily withdrawals are happening, something's going on, and the banks are becoming more astute about that. We have, the unauthorized withdrawals, changes in our wills and estate plans, abruptly disappearance of funds or stolen items. When bills are being paid and care is not being given, that's certainly something that needs to be addressed. Forgeries on signatures, oh my goodness, some things that people try to forge, just amazing. And then the appearance of new friends or new relatives, and this ties into the whole sweetheart scam also type of scenarios that we hear and see a lot of. So, being aware of those new friends and keeping an eye on that situation is very important. And then just that very last bullet point, the elders report of financial exploitation. It takes a lot of courage for people to come forward and say that they've been contacted, or maybe that they have given money. It's embarrassing. They fear that they might be retaliated against, or that their loved ones might say, gee, they're really losing it. I'm going to put them in a nursing home now. This is a hard thing. So when someone comes forward with this information, we really want to be responsive. We want to ask questions and see what we can do to resolve the situation. As I said, the banking industry has made great strides in this area. They're really coming forward and helping more. So I think all of us together can work on this and be aware. Okay. But now we have a special set of problems with that have arisen.
So let's all think about this impact again of COVID-19 and scams. Earlier on in our discussion, Julie was warming us up with information so that you could start to see how social distancing and self-isolation has not only people in the field of elder abuse prevention worried, but I'm sure will worry all of you as advocates. We have to expect that scams will be on the rise and perpetrators will try at all costs to take advantage of people. So we need your help in spreading what we know and what to be expected. We have to be mindful that scammers or perpetrators are going to use a number of tactics that are similar to what we've seen in other scams over the years. So they'll capitalize on inciting fear in people and making people feel very rushed to make abrupt decisions. They'll also make something seem very urgent. And they may make claims that they have the golden ticket or the end-all be-all answer. And also, they might pressure people to get access to their phones or computers. They might urge them to provide their social security numbers and other identifying information like their address, name of spouses, banking, credit card, or investment account information. So we really need to be very aware of this and nip it in the bud when we are hearing it and get consumer education out about this topic. So we thought that a way to really make all of these COVID-19 concerns relatable and digestible is by walking through several scenarios. So what we'll go through with these scenarios, I'll read them out loud, and after hearing them, we want you all to think about each scenario and suggest to us what you would do in these situations. And after that, we'll go ahead and recap what our pro tips are. So in looking at this first scenario, I'll just go through and read it. An older person receives emails claiming to be from the Centers for Disease Control and Prevention. And experts are saying that they have information about the virus. So before we move on to the next slide, how would all of you handle this information if you heard about this from an older person, that they received this type of email?
I've been reading in the chat some really great examples and scenarios that people have just faced in their own lives. So please keep those coming because they're very informative. And then this is the one we're seeing right now with the CDC emails that people are receiving requesting some personal information. And so, really good. If you're physically distancing caregivers, they may miss the signs of these things coming. I fear we won't become aware and will appear, and it will appear numbers are down. I think that's a very valid concern, and that's why, just being on top of what the latest scams are is really important. And we're seeing a lot of other good things coming through.
Good. Well, thank you all for participating. So let's go ahead and tell you our pro tip and what we would suggest. So you have to realize that the scammer might be trying to encourage someone to click on suspicious links or collect identifying information that I had just talked about, like social security numbers, home addresses, and the names of household members, probably beyond that. So what we want to encourage is the practice of people turning to the CDC and World Health Organization for the latest and greatest about information pertaining to the coronavirus. We know that not everyone has access to a telephone, a computer, or even a TV for that matter. So all that we could do to potentially print out those flyers and get that information out to people, we all need to do our part and really circulate these two resources and emphasize the fact that you have to actually turn to the credible sources and do the research on your own, or, as all of you were saying, contact the CDC directly. All right, so moving on to our next scenario. A person on the line claims to be calling from the local health department or hospital and exclaims that they have a miracle cure that they received special access to that hasn't been shared with the public yet. They mention it's just been shipped to the United States from a French pharmaceutical company. So all of our lovely advocates on the line, how would you handle this situation? Very good. I'm glad someone's mentioning that.
I love that. The health department will not reach out to you, especially right now. They're very busy. So yes, many people know that. You are I hope we can get copies of some of this great information that you all are putting out there. It's really great.
So those of you that are participating are spot on contacting the AG office as well, and do not expect a call coming to be from an agency. All right, so let's move forward, and because all of you are on the right path, we could go ahead and share with you our pro tip. So what we're encouraging people to do is ignore online offers for vaccination. There currently aren't any vaccines, pills, potions, or lotions. And according to what we've been seeing in the digestible segments of news headlines is that vaccines are expected not to be available in the immediate future. From what we've heard, it could actually be upwards of a year for the vaccines to be made. There will be credible sources that older people should be in contact with, and they should really be turning to their local health department or their medical groups, so possibly hospitals and primary care providers for this information when a vaccine is available. And they also should be proactive in reaching out and honestly can expect that there will be a streamlined system to be in contact with them about vaccination. So thank you all for interjecting with that. So our last scenario that we'd like to highlight, volunteers send brochures in the mail and follow up with telephone calls hoping to get your attention about poverty-stricken countries who are currently reporting a large volume of COVID-19 positive cases. They mention the cities are so poor that certain community members are unable to meet their basic needs of food, shelter, water, etc. How would all of you handle this situation? Great. So some of you would confirm the information with the CDC. Very smart. And we have to actually expect that these sort of volunteer requests will be on the rise, and that people will be trying to get in contact with older adults through the mail, potentially knocking on their door. So, okay, I love this one response from Teresa: if you don't know the sender, then trash the mail. Absolutely. And keep it local. And there are websites where you can actually check on the credibility of some of the volunteer-based organizations or charitable organizations. So people do have the capability to do some research online, or people should wait actually for referrals from trusted and credible established centers that are accepting donations for people that are in poverty-stricken regions across the country. So in terms of our pro tips, we highly recommend that people do their homework when it comes to donations. And whether through charities or crowdfunding sites, really do your research. Don't let anyone be rushed into making a donation. And it will be something that we could all flag as a red flag for ourselves when organizations are asking for cash donations or donations by gift cards or money wiring. We've seen that connected to other types of scams, so we want older people to be wary of this, and also all of ourselves to be wary of it, not just targeting for older people.
Very good. Yeah. Can you hear me? I lost it, and if you should lose me. I'm so happy Eden can just keep going. So you've had so many great things going on in the chat, and staying local, staying with what you know, all those things are so very good. So we also, I think, again, in general, people are leaving the news on 24/7, and that gets to all of us. So we said, don't leave the news in the background all day. Small snippets of it. I don't think we can probably keep ourselves away to just 10 minutes daily, but 10 minutes intermittently maybe. Take a break from things, as they're saying, exercise, do those things that you need to kind of work off some of this anxiety, and use the time to reach out to family members or friends that you do know, and you initiate being connected to those people that you know. You take control. This is your time to make that effort too. And we're asking our older adults, have that buddy system, have somebody that you can be talking to. We already mentioned screening your calls and emails. When you get out, just get the essentials, return home. And we love the Elder Care Locator. We're affiliated with them in another project that I'm going to tell you about. They have such good resources, credible resources embedded, and you can call them if you're not on the internet, because we always forget how many of our older adults are not using the computer, but they use that telephone, and here's an 800 number for them for the Elder Care Locator. And don't forget, don't worry about asking for help. Everybody needs help right now. We all need somebody to talk to and listen to us. And again, follow what the CDC is telling us, and we'll come out the other end of this as soon as we can. So all of us together in this. So here are some resources. We're going to give you a whole list of the resources at the end of the program again. But this is who we really work with. Now, Adult Protective Services, this is their national link to the National Adult Protective Services Association, NAPSA. So definitely you'll have this as a resource. We work through local law enforcement, and this is the cops.com site that kind of gives you that feeling for where all the field offices are throughout the country, and the Long-Term Care Ombudsman that Eden is in the Long-Term Care Ombudsman, and if you're not aware of this program, she will be telling you about. But I want to start with APS, and I want to go there first. We work with APS all the time, and they are phenomenal people. They really work hard. But when we put something out about APS on social media, like we talk about a success story or case, immediately we get this backlash of APS did nothing. And we want you to kind of have this reality check that when you have a conversation with someone, that you can be in tune with what APS can do legally. because unfortunately people's expectations of what they can do may not be realistic to what they are allowed to do. They can call the police and request a psychiatric hold and file a report of a crime with the police. They can suggest and persuade and bargain with the victim to get help, arrange for case management for that person, and assess their needs and link to services and assistance. But they also can work with the victims and their families in developing individual care plans if the person gives their permission to do so. And they can recommend guardianship or conservatorship in those very, very difficult cases where the person's self-determination, their right to make their own decisions, is outweighed by the safety factor, that they're not making good decisions any longer, and there may be a cognitive issue where the person has to seek guardianship, and in California we call it conservatorship when the person is over the age of 18. So those are some of the things that APS can do. But what they cannot do is enter a victim's home without permission. If they come to the door of someone's home and the person says, go away, I don't want to talk to you, they would have to come back with an officer then if they had a serious concern. Say they could stay in the house and they could...
Sorry about that, I was on mute. I was mentioning that I could jump back in for Julie as she was continuing to experience some technical difficulties. So I feel like she did do a thorough enough job to talk about what APS cannot technically do. And really an important aspect, which Julie will be talking about shortly when she's able to join back in, aspect of the right to self.
That it was, full of a lot of clutter, and they are able to do things. Whoops, so I have no sound. Okay. You hear Eden? Okay.
So I was just basically saying
that's okay. We have to keep going.
Yes, may not do, and then we're going to segue to the next slide. So yeah, I could go ahead and jump back in with the law enforcement piece. And thinking about what law enforcement can do.
Oh no, that's great. That's we teamwork. So I'm not sure, Eden, how far did you get? When did you pick up? Because I couldn't hear you.
Anyone calling into our resource center, that they actually get in contact with the police in the event of an emergency, and also in tandem with any reports that are being filed with Adult Protective Services, with the Ombudsman, and any other investigatory arm. We cannot expect, and I'd like to emphasize this, that agencies are going to cross-report to one another. So what we're trying to reflect here are all of the capabilities that law enforcement has. And basically, here is what they can participate in. So obviously, they can respond to emergency calls. They can work in tandem with other first responders, such as paramedics or firefighters that might need to get dispatched. They can also collect information, observe a setting and someone's surroundings, and they are very skilled at conducting interviews. They also assist other professionals involved in elder abuse cases to recognize telltale signs of abuse. They also collect evidence to substantiate those allegations, and they provide referrals to community resources that might be able to support that victim.
All right, so we want you to know about our Elder Abuse Guide for Law Enforcement, because although it was created by and for law enforcement through a grant from the Department of Justice to the National Center on Elder Abuse, we think you can benefit from it, and it's free and it's there for you. There's the link. You can also just do eagle.usc.edu now. That just happened yesterday, so that will get you to the Eagle site. On this site, you have checklists. You have you can put in your zip code, and it will pull up the closest APS office to you. All kinds of resources. I think, of course, I think it's phenomenal, but I think it will be of great assistance to you. Interviewing techniques, all kinds of things. So I would just ask that you would take a look at it and see if it would be a benefit, because I think you can find a lot of great information here. So that's my little commercial for Eagle. And so now I'll kind of go back into a point that I was making before about the right to self-determination. You and I make decisions every day. And as we grow older, we want to keep the decision-making capability. That doesn't go away. So when people make bad choices, Even had somebody on a technical assistance yesterday that she was trying to tell her all the things, and the woman just, has tried everything for her mother, but her mother just is going down this path, and she has capacity. Sometimes there isn't much more you can do than know you've tried everything you can, and then when it is a portion of going into, crossing that line into safety, then you start to initiate that guardianship or conservatorship process. So it's not the path we want people to have to go down, but sometimes it's the only path. But up until that point, they can make bad decisions, and we're all entitled. So you might not agree with them, and that's a hard thing to accept sometimes. But unfortunately, that is what we have to deal with here sometimes. So we also have another entity to help you, and as I mentioned, this is something that Eden has gone through all the training.
So this is just a brief highlight of some of the aspects that long-term care ombudsmen can get involved in. They also identify, investigate, and resolve complaints made by or on behalf of residents. They provide information to residents and their loved ones about long-term care services that someone might be available, or that might be available to some of the long-term care residents. They help understand their rights and exercise their goals. And I'd also like to note with the program that written consent is required for everything that's done. If a resident reports something to an ombudsman and they're not signing off on a form that indicates that the long-term care ombudsman has the ability to act as an advocate on that resident's behalf, then you can't do anything. And most importantly, the ombudsmen are there to advocate for changes that will in turn improve residents' quality of care and quality of life, and ultimately protect their well-being.
And Eden, I just want to jump in with the second one of witnessing the Advanced Health Care Directive. That's only required in California. So I should qualify that. I'm not aware of other states that have it, but that's just a California requirement. Eden and I are sitting here in California, so that's how that one got into the slide deck. But that's why Eden and I are so happy to be here with you today, because it does take a team. These cases are complex, multi-level, where there's financial abuse, there's often emotional abuse, or there could be other types of physical abuse or things going on. So we need experts in a lot of different areas. And if you have a multidisciplinary team in your area, please seek them out. If you're not sure, then we can assist you. The Department of Justice has a listing of all of them, and Eden and I are also part of a multidisciplinary team resource center project. So you can, and there'll be a website coming up soon on that project. So it's really great to have different professionals to talk to and go over these complex cases with, because we can't do it in a vacuum, and if we want these cases to get prosecuted, we need to not only have the advocates and the banking industry and the prosecutors all together in one room, so that it can really make an impact and make a difference on people's lives. So that's why it takes a team, and that's why we're happy to be working with you today. All right, so we're kind of coming full circle.
And we all have a duty to know the signs of elder abuse and report those suspicions. Our loved ones and the people that we're advocating for are obligated, we're obligated to fulfilling that promise to those people. So what I want you all to keep in mind is to listen to older people and caregivers to understand their challenges and help them with providing support. Educate one another about the signs of abuse and how to get help, and reporting those abuse suspicions are of paramount importance, and they have to be reported as soon as possible. We all want to take into consideration to also build a community that fosters social connections and support. We want to utilize and take advantage of professional services that are available to support our older generation. And finally, we don't want to be afraid to reach out for support from local health and social services. And we need to be encouraging the older people in our lives to take advantage of those programs.
Okay, so just in trying to keep up with the chat as it's going on, as always, Nova has some amazing people already on the front lines, and you are part of the change. It's just incredible. I just feel like, you kind of helped to verify a lot of the things that we see and that we're doing, and that we're on the right path. So what do we need for change going forward? Well, we need common definitions because they vary state to state. Things are all over the place with regulations. So we do need some standardization to make things a little more uniform in going forward. We need some common reporting standards. Adult Protective Services can kind of work independently, but that's changing. We now have some suggested standards for them to use, and they've been wanting them. So ATS workers are all collaborating, and we're going to see a more uniform system for reporting. And then what you need to have is somebody tracking this information, finding out where the trends and gaps are. And that's also happening behind the scenes, and they're making great progress in seeing how people are handling different cases, all the different types of abuse, because people tend to focus on one or another, and see what the outcomes are. So down the road, each year it gets better. Down the road, we're going to really have some great research and information that we're lacking right at the moment. We need champions and leadership, and you're proof of that. So you're here calling on you to go forward from after this presentation and keep in contact with us. And then we need to improve our trainings. The EAGLE training is being put into face-to-face trainings for law enforcement across the country so that they realize that financial elder abuse is a crime. Just because someone gives someone some money doesn't mean they weren't coerced or that undue influence wasn't applied. These are things that they're becoming much more aware of, and it's been really gratifying. Documentation has to be clarified and improved, and again, back to that reporting function. People don't report, it's not happening, and it doesn't get the attention that it really needs. And then we need funding for research. We're just in the beginning stages of finding out why people make the decisions they do. It's fascinating, and more things are happening, but we hope that will just continue to grow. And I want you to all know about our Global Day of Commemoration. Oh, whoops, and you put the date on there. This is June 15th of 2020. It's every year on June 15th. This is our World Elder Abuse Awareness Day. I know many of you know of it and have possibly done something in the past to support it. If you have, we would love to hear about it. We'd love to highlight different countries throughout the world in what they're doing, because this is a global issue. Elder abuse is not just happening in the United States. Canada has an amazing, robust program. Australia, we are coordinating with this year because they have a human rights campaign that's just unbelievable. Ireland is doing a lot in the area. We've been reached out from Asia, and China is doing some work here also. So it's a global issue. You can do things like wear purple, tell someone else about it. There's so many amazing events that you can find on our website, and you can join in. Some simple things, some that take a little more, but we would love to have you join in, and we would love to have you let us know what you're doing so that we can publicize it. Okay. Part of this campaign last year is we started a new feature called Lifting Up the Voices of Older Survivors. This is phenomenal. We work with a group called NCAL, the National Clearinghouse for Abuse in Later Life. They're based out of the domestic violence portal, and it's grown into an amazing area of research. And I don't know if any of you know Bonnie Brandel, but she is somebody we work very closely with, and her whole team. And they came up with this amazing video project. And the 3 people represented here are 3 of the 10 people that they have on a video series that you can use. They want you to use and encourage. And it talks about people's experiences in the system, how people have come out on the other side of going through abuse, what they had to do, what they learned. It's really phenomenal. We're so happy to be collaborating with them on this. And we can hope to continue to do that this year also as we move forward. So some of you may have things that you'll want to share in this whole part of the campaign. So we encourage, especially with all the people that you know and that you've been supporting and helping in the past. So we do want you to know about this portion of World Elder Abuse Awareness Day, the Love Campaign, Lifting Up Voices. And it's something we just hope to see grow and grow this year during WEAD.